Hi, everyone. This is E. David Crawford, and I'm an editor-in-chief of Grand Rounds in Urology. Joining me today for our monthly conference is Dr. Greg F. Murphy from North Carolina District 3, who also is a member of the House Ways and Means Committee. And also, Greg, congratulations on the primary. And what an outstanding victory you had with 75.8% of the vote. And I think people recognize what you do and thank you for what you do.
Well, I appreciate it, David. It was, it was a lot of work, but we came out very well, and I'm honored to serve what is, I believe, the greatest district in the country. And so we'll keep working and doing that not only for district folks, but for the whole country.
Oh, good. People really enjoy listening to our talks because they are bipartisan and they touch the practice of urology. And I want to talk to you about something about drug approval. When I was chair of the GU committee of SWOG many years ago, did that for 28 years. Earlier in my chairmanship, we had a couple of drugs come around, an anti-androgen, this drug called BCG. And we did the trials that actually got those two drugs approved. And we said back then, BCG works for carcinoma in situ, and we're doing cystectomies and other things like that. How quickly can we get that approved? And it took a couple of trials, and we know that from studies that when a pharma company discovers a compound, by the time he gets to market, it's sometimes 8 to 12 years and millions of dollars. And we all kind of thought about, and Congress did a good thing a number of years ago and passed an accelerated approval program to deal with some of these issues about promising drugs and getting them out early. And in fact, there were some good things, but like anything that's out there, it gets abused, and it got a lot of abuse. And so now I understand that Congress is looking at that again and going to fine tune it, or what's going to happen with that.
Yeah, David, pendulums swing, and we all know that. And sometimes they swing appropriately, but oftentimes they swing too much in one direction and they need corrections. I think we saw a lot of that during the whole COVID, during the entire pandemic. We saw a process that normally takes 10 years for a vaccine approval to take 10 months. And whether that was the right thing, the wrong thing, I think the history folks will tell us. I think a lot of the issues that come out now about vaccines, while I think this was altogether the right thing to do, I'm still a little bit leery of vaccine for everyone, which some people in the higher institutes of medicine want to push, because I do believe there are directed populations we should use this for and others we should not. But that said, it pushes technology sometimes probably a little bit faster than what we should. And so, people want cures. They surely wanted a preventative measure for COVID. But then you have to look at sometimes saying how quick do we push it and at what cost? So I think there will be some rebalancing. Sadly enough, as we've talked about, some of the politics entered medicine during this period of time, which is very sad. But I think in a recalibration mode, it is appropriate that we sit back and try to be again objective, which is what we're supposed to be in science and medicine.
Well, yeah, there certainly is a need for that, and orphan drugs and a lot of things like that. But as you said, the pendulum swings back and forth, and now it's time to bring it back to center. When are you all going to be taking a look at that? Is that coming up soon, or?
Dave, I don't have a timeline specifically on that. The FDA kind of controls a lot of those things. How much input Congress is allowed is up to the majority party, of which I'm now not a party, but I think I will be come November. And I think we'll have a lot more influence when that time comes around.
Yeah, and you mentioned the vaccines, and that was one of the shining stars, I think, of our healthcare system, is that we were able to bring forth something in such a short period of time that's novel and that did work. And I think that the shortcoming was the way a lot of things were handled. And I don't want to get into the weeds of the politics of it, but
Yeah,
hey, you mentioned, I think people have a right to decide if they wanted the vaccine or not. I got all three of them and I'm going to get the fourth one. But we don't know what the long-term risks are.
right.
Probably, but I worked in Dr. Albert Sabin's lab many, many years ago when I was training in Cincinnati. And there was criticism of him with the oral polio vaccine
Sure.
and threats and so forth. So we have to have a balance, and that's what we need. We really need a balance.
Yeah, definitely so. And so, we are finding out there are rumors that some of the information about side effects and some of these other things were hidden in an effort to get this drug out, the vaccines out very, very quickly. The veracity of those really needs to be investigated. As we know now with social media, good Lord, everybody's a Google doctor and everybody has the latest, greatest cure or the latest, greatest criticism of what's going on. So again, you and I grew up in a world when science was 100% objective, and that's the world we need to get back to, where we study things, we study drugs, and we fully vet them for the long term, not just the short term gratification.
I tell you what, if you all find out that folks have hidden side effects and things like that, that is unacceptable, and that's one of those things I think you need to go for the jugular on. Let's change the topic here, and there's a lot of things going on in medicine about racial diversity and equity, and one thing after another, and there's a lot of concerns out there, and we need to stay on top of them. But what are sort of your thoughts about that? How do we deal with it, and what impact it's had on our practice in medicine?
Yeah. David, I think the word balance is a word that is not used enough recently in a lot of different spheres. When you say what is the most appropriate action, we talk about pendulum swinging one way or the other. We do know that racial inequities occur and exist in the treatment of certain disease, access to diseases, some of which can be dealt with and other ones that can't be dealt with. The sad thing is, I think that during this pandemic, we saw that medicine became an instrument for political science, not so much medical science, and that certain social justice initiatives came down to be pushed into medicine as science. And that certain forces pushed one way or the other. And if you didn't believe the way this group believes, then you're wrong, or vice versa. And, I think we need to step back and we look at balance. What is the bottom line in all of this? In all of this is we want the right thing for patients. And every single citizen in this country and worldwide are patients. And so how do we best treat those individual patients? Having a white doctor versus a black doctor, we want the best doctor. We want the most opportunity for everyone to become doctors. But at the bottom line, if you're a patient and you want a surgeon, you want the best surgeon. And so it's a balancing act. And unfortunately, and we were talking about pendulums a little bit earlier, I think the pendulum has swung one way, pushed one way or the other. And I think somewhat of a recalibration, stepping back, trying to be doctors again, and not social scientists per se, is really what's important. We need to be objective. And sadly enough, some of the leaders in the country, medical leaders, became very political during this entire time. And I think that's really why the American people, their trust in physicians and institutions of medicine during this time has actually plummeted, because they saw things being done for political reasons, not objective science reasons.
I think that's a very good point. And we have to give opportunities to various races to ascend in the system and get into medical school and do a good job and become the best surgeon. And I know you and I, and a lot of people have tried that over the years. I think some of it, I remember I was involved with starting Prostate Cancer Awareness Week back in 1989 to help men find the disease earlier. Yeah. And fast forward, we weren't getting enough African Americans in, and they had a more advanced disease. And so I tried to approach Bill Cosby to help And one day in my clinic, my nurse said, "Bill Cosby's on the phone." I said, "Right." You know, I remember, he's a great guy then, and he still is. But anyway, he said, "Doctor, I understand." He said, "The problem is that we lead these people to a diagnosis and they always don't get the best treatment." And I think that was right.
Yeah.
I studied outcomes at Henry Ford, which has over almost a 30% African-American group that's in their captured care their healthcare plan rather. And what I found out was, and we published this, that African Americans and Caucasians had the same survival rate for localized prostate cancer when they chose the same treatment. And a lot of it had to do with the treatment. So there's a lot of variables that exist. But what I don't know, any thoughts you have as we end what we can do with it? There's a shortage of doctors right now. There's a shortage of urologists. This is horrible.
Yeah. And it's not going to get any better, both you and I, it's going to get much worse before it gets better. You know, I go back to so many things of, you talk about culture and race and gender and all these other things. We can talk about the whole gender issue at another time. There are a lot of cultural differences in the African-American population. You know, if you go back to the tragedy of the Tuskegee vaccine issues, there were a lot of reluctance in the Black community about getting vaccinated because they thought, you know, and I can tell you this personally, point blank, you know, I still see patients, you know, that folks telling me that. And actually, I have a large proportion of African-Americans in my patient base, and we talk about these things. You know, there are a lot of cultural differences bringing people to the forefront, and it's through education. But, you know, pushing things from a social standpoint, I don't think is educating people. I think it's pushing things and not necessarily, maybe the motives are good, but maybe the methods are not quite. And so again, I'll go back to what I said originally, balance. And I think we've lost that in so many segments of our society and in medicine for that matter.
Yeah, we've got to get back to a bipartisan move forward. And I know you're one of the people that's doing that, and you're still practicing. Congratulations. And Greg, we're very happy about what happened in the primary, and you're very deserving. And we look forward to talking to you next month. Good luck. You got a lot of work on your plate.
Great. Thanks, David. God bless. Have a great day.
Thank you, Greg.